Hello everyone, my name is Lauren Boylan and my presentation is on lateral violence in nursing. At the end of the presentation, the learner will be able to do the following. Verbally identify 3 behaviors of nurses that define lateral violence. Discuss one effect that lateral violence in nursing has on our healthcare system. Discuss one effect that lateral violence in nursing has on our society. So what is lateral violence? The concept of lateral violence, or horizontal violence, was first discussed over 3 decades ago. Lateral violence can be defined as a pattern of workplace conflict in which hostile, aggressive, and harmful behavior by a nurse or a group of nurses towards a coworker or a group of coworkers via attitudes, actions, words, and/or behaviors. Initially, the behavior was believed to be related to a lack of power of nurses within the workplace. However, there is not one exact cause for the violence. Most recently, the most endorsed potential cause of lateral violence among nurses is the stress related to inadequate staffing or resources to handle the workload. Lateral violence nursing behavior is intended to overtly, purposely demean, humiliate, or diminish their peers' character, resulting in social exclusion within the workplace. Examples of behaviors include and is not limited by verbal assaults, persistent criticism, belittling, eye-rolling, withholding information, refusing to help, and gossiping. Lateral violence leads to high turnover rates within the profession, which increases the financial burden of institutions, who spend approximately 25 to 50% of an annual nurse's salary to replace the nurses that leave. New nurses are also more susceptible to the violent behaviors, and an estimated 25 to 33% of newly licensed nurses will leave the profession within 1 year. Student nurses often either experience or witness lateral violence during their clinical rotations. Leaving these situations unaddressed can lead to the formation of maladaptive coping mechanisms, or worse, the impression that lateral violence is an accepted routine and aspect of nursing. Workplace violence directly impacts staff satisfaction, employee turnover, staff members' mental and physical health, patient satisfaction, and quality of care. The Joint Commission identified that intimidating and disruptive behaviors fuel medical errors and lead to preventable adverse outcomes. Due to negative impacts on patient care, the Joint Commission for Healthcare Accreditation appealed to all healthcare organizations to take measures to decrease behaviors that undermine a culture of safety. Lateral violence doesn't only affect the nursing workforce, but it also affects the healthcare industry as a whole. Lateral violence in the healthcare workplace is costly, destructive, and places patients at risk for diminished health care. Workforce retention is another casualty of bullying and lateral violence. Lateral violence creates negative patterns of communication across the spectrum of healthcare team members and ultimately leads to increases in medical error, which in return costs healthcare institutions millions of dollars. Although lateral violence is most prevalent in nurses throughout the healthcare profession, the behaviors are also demonstrated in other professional areas of healthcare as well, such as physicians and other advanced practice providers. Not only does lateral violence affect the nursing profession, the healthcare system as a whole, but it also impacts society. Lateral violence gives society the impression that nurses eat their young, which contradicts the values that the general public expects from professional nurses. Lateral violence leads to a lack of active nurses within the workforce within our society because new nurses or student nurses that are exposed to the behaviors enter the workforce, and it continues, forcing them to feel uncomfortable and either leave, which eliminates a body from the workforce, or continue to stay and later on develop the same set of negative behaviors towards newer nurses. So it just creates a cycle that needs to end. It also creates a need for educational reform in nursing to educate nursing students about the concern for workplace violence. Recently, over the last 3 to 5 years, educational programs for nursing are now incorporating a class strictly on workplace violence and lateral violence within the field, and they're often teaching scripted sessions and scenarios to help new nurses stand up and confront the bullying behavior as it occurs in hopes that it'll stop the behavior from occurring throughout their professional career. Overall, the key points to remember are that lateral violence in nursing is being a bully. It is extremely costly to our healthcare system as a whole. And lastly, it makes the profession of nursing look unappealing and unprofessional within the eye of our society. So let's do us all a favor and end the cycle. Thanks for watching my presentation. I appreciate your time.